Hello everyone, my name is Surina Taneja and I am a surgical trainee working in the UK. Today I'll be talking about the MRCS Part B. The resource I used by far the most out of everything I'm going to mention in this video was Pass the MRCS, and so I am so thrilled that they are sponsoring this video and I can't wait to tell you more about them later. So what is the MRCS Part B? If you've watched my previous videos or sat the Part A exam, you'll know that Part A is a written exam based on single best answer questions, whereas Part B is an OSCE style exam where you move from station to station, verbally communicating different aspects of surgery. You need to pass both of these exams to gain membership to the Royal College of Surgeons and be eligible to apply for specialty or registrar level training. What that looks like in the context of career progression in the UK is that you graduate medical school and then become a foundation doctor and spend your 2 foundation years, FY1 and FY2, rotating in different medical and surgical specialities. Then, if you decide you want to do surgery at this point, you apply for core surgical training, which is 2 years long, your CT1 and CT2, where you spend the 2 years rotating in different surgical specialities. Then, when you decide which speciality you want to specialize in, so general surgery, urology, vascular surgery, plastic surgery, then you apply for your specialty training, which is from ST3 to ST8, so yes, 6 years specializing in that field of surgery in particular. And then after that, you're eligible to apply for a consultant job. Both the MRCS Part A and Part B have to be completed by the time you go to apply for specialty training, which means you have to complete them in your foundation and core surgical training years. So let's talk about the exam structure of the Part B. The Royal Colleges have produced a helpful document, which I will link in the description box below, which goes through all the content and layout of the exam, so I recommend looking at this early on. As mentioned, the Part B is OSCE style, which means you are interacting with examiners and patient actors in each station, and as well as your knowledge being tested, your communication and professionalism skills are being assessed too. There are 17 stations in total, which are divided into the knowledge section and the skills section. There are 8 stations in the knowledge and 9 in the skills. The knowledge section is further divided into 2 surgical anatomy stations, 3 surgical pathology, and 3 surgical applied sciences and critical care stations, which usually involves the interpreting of some data, such as blood test results and imaging. The skills section is broken down into 4 communication skills stations, where you may be taking a history or giving information to a patient, relative, or another healthcare colleague, and 5 procedural skills sections, where they will be testing basic surgical skills. Each station is 10 minutes long, which allows for 1 minute of reading time and 9 minutes of actually doing the station and being assessed. Each station is marked out of 20 marks, but there will be 1 extra pilot station which is just being tested to be used in future years, and so won't actually make up part of your final score. You must pass both the knowledge section and the skills section in order to be able to pass the exam overall. Looking at the pass mark for the exam session I sat, you needed to get 106 out of 160 for the knowledge section, which is around 66%, and 118 out of 180 to pass the skills section, which is around 65%. Next, moving on to resources. One of the hardest things I found about this exam was to just get my head around what the exam entails and what resources to use out of all of the many that are out there. So here I will summarize what I think is a good strategy to help tackle this. The place I would start is this sort of blog website style thing called MRCS Resources, which some kind soul has created, which summarizes lots of important resources and gives you strategies to revise based on the time frame that you have available. On the note of time frame, I started revising in mid-July and my exam was in mid-October, so that was just about 3 months in total. I would say that was just enough time, with the caveat that for most of July I wasn't working because my CT1 job didn't start until August, so I had a lot more time then to get a bit of a head start. I would say that 3 months was the right amount of time to pressurize me into just about having enough time to finish the content and to really cram that knowledge in towards the end, which is how I work best, unfortunately. However, it's not the wisest method, it's not very sustainable, so I wouldn't recommend that unless you are someone like me who thrives off that. And I think 4 months would be a more comfortable time, especially if you're working throughout all of those months. The must-use books that I recommend is firstly an anatomy atlas. There are tons out there. There is Macminn's, Harold Ellis, Netter's. I use Macminn's because that's just what I could get hold of a PDF copy of. But they're all absolutely fantastic. The key is that you need to be looking at atlas images, so the cadaveric images, the prosections that they have on these pages. Those are the images that you'll be shown in your actual exam, so you need to know what the structures look like in this setting, because it turns out that arteries, veins and nerves aren't red, blue and yellow like they are in diagrams, in prosections. Everything's just a bit beige, so you need to get good at recognizing structures when everything just looks like a bit of a beige mush to start off with. A tip for this part is that they really like using very weird angles of anatomy in the exam, so they might show you things in half or things from below just to confuse you a little bit more. And a book that was recommended to me was Core Anatomy Illustrated by Parkin, which is another anatomy atlas but is quite good at showing you these more weirder angles of dissections, so I found flicking through that closer to the exam very helpful. Next is Get Through the MRCS by Zavary and Overstall, and this is an excellent resource for answering anatomy questions based on those atlas style prosection images. It goes through all of anatomy top to toe. It has some really good pictures in there. I would suggest getting through this book at least twice. I didn't quite manage it, but wish I had. Be warned, I've been told that some versions of this book from Amazon are delivered in black and white, which completely defeats the purpose, so make sure you check that before and make sure you get a coloured copy. Pathology and physiology was definitely much harder to revise for because the breadth is absolutely huge of these topics and it's not easy to know which parts are relevant to the exam. I found myself going back to the Basic Sciences for MRCS textbook by Rafferty, which I'd recommend in my Part A video and I'd used for Part A because I found that really honed in on the important topics well. Next, moving on to the clinical examinations, I would recommend the Doctor Exam textbooks, specifically Book 2 is a brilliant resource for going through every single clinical exam that can come up in the Part B, going through how to do it, what common signs and symptoms you might see, and discussing common pathologies as well. So it's a really, really comprehensive resource. I pretty much read it from cover to cover, and I found that covered most of the things that I needed for the exam. There is a book 1 in the series which goes through anatomy, pathology and physiology, I believe, but I didn't use it because I had more than enough resources for those topics. Next, moving on to online resources. Now, everyone's always asking which question banks to use, and I haven't used all of them by any means, but the one I would definitely recommend based on my experiences would be Pass the MRCS. Pass the MRCS has tons of online stations that you can work through covering all categories that come up in the MRCS Part B exam, including anatomy, pathology, critical care, history, examinations, and clinical skills. I found all the stations were an accurate representation of the content and the depth that actually comes up in the exam, so it was a really great framework to base all of my other revision around. My favourite thing about Pass the MRCS that made it stand out from all the other resources was the way that it is laid out like an actual station, asking you questions one at a time to encourage you to speak out loud and really get into the practice of verbalizing your answers. You have to get comfortable with the simulated patient and examiner interactions in this exam and can't rely on just rote learning the content, and encouraging that practice is where this resource stands out. Plus, the detailed feedback in the answers were really to the point and helped me focus on what was actually important for the exam. I honestly wouldn't think twice about getting past the MRCS, but if you're not sure, not only have they just changed their payment options to be a monthly cost rather than an upfront bulk cost, they've also given me a code to share with you today. Surina10 will get you 10% off your first month, so go and give it a go, and I hope it brings you the same success it brought me. Pass the MRCS also gives you access to Ackland's Video Atlas of Human Anatomy, which are a series of unreal videos that Dr. Ackland, a professor of surgery in the States, has put together, where he goes through the entire body with these beautiful prosections in a really good amount of detail for surgeons, I think. Be warned, the videos are definitely quite dated. I think they were filmed in the 90s or something, so they're a bit strange, a bit retro. But the dissections are absolutely phenomenal for helping you gain a 3D appreciation of the anatomy and being able to orientate yourself and talk about structures and relations a lot better, or at least I found it helped me with that a lot. The MRCS-B questions is the second question bank, which was a classic panic buy when I thought I needed as many resources as possible. Now, this was a good resource to practice more stations. It had anatomy, pathology, and physiology stations, which were pretty good to go through, but the actual interface was very difficult to use, and I would only use this as a resource if you'd exhausted everything else I've mentioned so far, because this was good towards the end, closer to the exam, to give me some more stations to practice, but I didn't find the explanations or the depth of the knowledge to be as reflective of the exam or as concise as Pass the MRCS was. Next are two websites which I'm sure you've come across if you've been revising for the Part A before or done any surgery or anatomy really, because they are really, really fantastic free websites called Teach Me Surgery and Teach Me Anatomy, which have really great diagrams, really good explanations, and in particular, Teach Me Surgery I thought was excellent for the clinical side of the exam because it summarizes your history, presenting symptoms, your investigations, and your management for all the common surgical scenarios. So I found this really useful for the clinical side of this exam, but also really useful for work because the guidelines and everything seem to be quite up to date and quite applicable. The next key online resource, which has been with me for pretty much all of my exams for as long as I can remember, is this very platform itself. YouTube is absolutely fantastic. There are always new videos I discover when I'm revising for exams. So in particular for anatomy, I love the Anatomy Zone channel, the Noted Anatomist, and another anatomist called Sam Webster, who has a great channel as well, going through anatomy models and things to talk you through things, and again, a bit more of a 3D manner. Now, I stand by that you absolutely do not need to do a course to pass either the Part A or the Part B exams. However, my place of work had a study budget that would fund a course for me, so I thought I might as well. Now, I would say out of Part A and Part B, a course is definitely more useful for Part B because this exam relies so heavily on communication skills. Any practice to speak those things out loud is extremely valuable. The course I went to was okay because the most valuable part of it, which is the mock exam, where you actually practice going from station to station and talking out loud, was only around 7 or 8 stations long, whereas I know for other courses that friends and colleagues went to, their mock exams were much more extensive. And so I think if you're looking for a course to go on, look at that important component of it, because that is where the value of the course will lie. Some of my friends went on courses where they had around 20 plus stations in the mock exam day, and that is so useful to not only get into practice of communicating things out, but also build the stamina and understand what it feels like to go from station to station, switching your brain into different aspects of surgery that they are testing, and to recreate that in a mock exam is extremely useful. Okay, so you know what the exam involves, you have the relevant resources, but how do you actually revise? My advice would be to start at the end. As I have mentioned a few times, the breadth of this exam is absolutely huge, and it's very difficult to know what depth to go into for which topics. There are significant similarities between past and future stations, and seeing them and going through them helps get you into the mindset and knowing what depth and detail you need to learn topics in. I would really recommend resources like Pass the MRCS, as well as MRCS resources, and talking to friends and colleagues who've sat the exam to understand what stations come up and start building a sort of contents page or syllabus from there. I have a phrase which I've used for pretty much any challenge or project I've done before, whether that's planning a wedding, running a YouTube channel, or indeed revising for the Part B exam, which is to diverge and then converge. What I mean by that is before you start revising, really giving yourself time to really deep dive into all of these resources, pulling together all the different stations you can find that have come up before, and building a really extensive and comprehensive contents list. Once you've got this list in front of you, you'll start noticing links between them and be able to condense topics into smaller topics and be able to really see and have a map of what you need to be doing and where you need to be going in order to cover all the content effectively. The next challenge is figuring out how to learn all of this content. A video that appeared at a really good time in my life when I was busy revising for this exam was this video by Elizabeth Phillips, My System for Memorizing Everything. She made me realize that the techniques I was using to revise for this exam was not actually conducive to the style of the exam. In this video, she talks about vertical versus horizontal learning. Vertical learning is a way I think that most of us learn because it's a way a lot of us have been taught. That is by picking a topic to revise and then revising everything about that one topic underneath. So for example, I would pick bowel anatomy as my topic that I wanted to look at, and then underneath have parts of the bowel, the blood supply, the nerve supply, the relations, and learn all of that as a big entity before moving on to another topic, such as anatomy of the liver or the spleen. The problem with this is that bowel anatomy remains this big entity in your brain, which is very difficult to conjure up specific details from or to make links into pathology and relevant physiology from, because it's this kind of one big mass which is quite difficult to remember and quite difficult for our brains to dig up, especially in times of stress such as an exam. Horizontal learning, however, is where I would take a topic such as the bowel, instead of limiting myself vertically to all the anatomy topics within it, I would do some anatomy such as the blood supply, and then make a horizontal connection into surgical anatomy or applied surgical sciences, looking at colorectal cancer, looking at the locations of different cancer and how the blood supply links to what kind of surgery you offer patients, and then making a link from colorectal cancer into surgical pathology that's relevant, such as familial genetic syndromes that lead to colorectal cancer, such as familial adenomatous polyposis or Lynch syndrome, and then making links back into anatomy at different parts of the bowel, what kind of stomas patients end up with after various surgeries. As a result, you end up with this horizontally expanding web of multiple data points within one topic. So when an examiner is grilling you on bowel anatomy and then throws in a row question about pathology or clinical surgery, which they will, you'll have those links ready in your brain and be able to conjure up information quickly and concisely, which is definitely the name of the game when it comes to this exam. Another great thing about this technique was that I ended up getting through the content much faster as well, as if I sat down to do one topic, I ended up covering many more in many other domains of the exam, and so there was much more momentum throughout the revision process. My memory cues were much stronger when it came to recalling facts, and also kept things a little bit more interesting and stimulating, because revising for 3 to 4 months on end and getting to that stage when all your life is going to work and then revising can become very draining very quickly. Next is to practice out loud. I would really recommend talking out loud as early as possible, right from the beginning of your revision, because as cringe as it is, it's really important to flex that part of your brain that gets you talking and gets you talking slickly, so that when you're tested under exam conditions and you're a lot more nervous, this part of the brain has been worked really well and it becomes more muscle memory. And yes, I know the brain isn't a muscle, and yes, I've definitely passed this exam. Just wanted to share my quickfire absolute top exam tips. Number 1 would be to have a study buddy, because you need to be practicing out loud. Like I've mentioned, it's really important that, yes, sometimes you just do that with yourself, but you also need to make sure that another person is understanding you and that you are able to test yourself under more timed and maybe slightly more stressful conditions. So make sure you've got someone that you're practicing with regularly. Next is to always structure your answers. By structuring your answers, you come across organized and methodical, which is vital in surgery and surgical thinking and decision making. But also it just makes your examiner's life much more easier. They will be listening to multiple versions of the same answers all day. And if you can deliver to them what they need to hear to give you those marks, it will make it just all that easier for them to go down and just keep ticking down the mark sheet. There were moments when the examiner and I sat in absolute silence because I didn't know what to say, or even worse, I was saying things and I could see them giving me obvious zeros or X's. That will happen in the exam, but if we can avoid it, then all the more better. So methods of structured answering that I like are, if you are describing the causes of something, dividing it into anatomical causes, so causes of hematuria, blood in the urine. You could do kidney causes, bladder causes, and prostate causes, or you can use things like the surgical sieve. I use vitamin C, D, so vascular, infective, traumatic, autoimmune, metabolic, inflammatory, neoplastic, congenital, and degenerative. Yeah, I think that's right. Still got it. If you're asked about complications of something, I like dividing it into preoperative, intraoperative, and postoperative. Or you could also do immediate complications and delayed complications. And if you're asked about the risk factors of something, usually non-modifiable and modifiable is a good one. It provides as a tool for structuring things, but also as a method for helping you remember things as well. My final tip would be is to really remember that there are marks up for grabs. Each station is marked out of 20, and whilst the majority of those are for specific knowledge and facts you need to know, a significant proportion are for your communication skills and professionalism skills as well. So the way you come across, your body language, and how you consider different questions. If you're asked something and you don't know the answer, don't say, I don't know. Just say, can I have a moment to think about that? Or can I come back to that later? Because not only does that make you come across thoughtful and someone who doesn't panic, which is worth marks as well, it also gives you more thinking time and signals to the examiner to come back to that question, which they will, and helps you grab any last minute marks, which are very precious. I did a little Q&A over on Instagram asking if you guys had any other questions about the Part B exam, so I'll just answer a few of those now. First was, when should you sit it? In my Part A videos, I've linked to some evidence which suggests that the earlier you sit that exam, so in F1, the more likely you are to pass it. In the same paper for Part B, the highest pass rates were seen a little later in CT1. Anecdotally, I would probably agree. Part A does not require first-hand clinical surgical experience and can be read and practiced from textbooks and question banks. Plus, I think once you know you want to do surgery, it's a really good idea to get Part A done in your foundation years so it's out of the way, because once you start core surgical training, your other requirements for your portfolio, for preparing for registrar training, etc. really piles up. And I think fitting 2 exams in would be really tricky. Plus, for Part B, I think clinical surgical experience is much more useful. Having said that, of course, you need to make your own personal decision based on what you have going on in your life, what kind of jobs you have, and when it makes sense for you to sit these exams with a more holistic approach. Next, I was asked, how much knowledge from Part A do you need from Part B? This is a great question because it's something I didn't quite appreciate. There is a lot of crossover between Part A and Part B. Although the knowledge is tested very differently, the actual content is very similar, and I do slightly regret having such a big gap, I think around 2 years, between doing my Part A and Part B, because it meant I learnt all of that anatomy, pathology, physiology, almost nearly forgot it all and had to relearn it all for the Part A. So I think the time to revision could have been shortened and maybe a lot more efficient if they are done more closer together. Having said that, doing 2 exams in a row is not easy. That is months and months of constant revision. So there are advantages and disadvantages to both, but do be aware that there is a fair amount of overlap. Next, I was asked, how did you prepare for procedural skills? That is quite a tricky one actually, but your hospital's store cupboards / the nurses who know where the expired stuff is being sent will be your best friends. I've spent a lot of time collecting out-of-date sutures and needle holder kits and things we used in clinical skills at med school. To practicing your suturing and knot tying, you can get some really good kits on Amazon of those kind of skin-like squares that you can practice putting stitches in. I was practicing knot tying on anything, banisters or poles and things that you have in the house. For other procedural skills such as central lines and catheters, there are loads of great videos online, which I mainly found through YouTube, and kind of watched them to understand the steps of what to do and kind of practicing it like that. It wasn't ideal, but if you have a clinical skills centre or something in your hospital, I would definitely ask them. Thank you so much for watching. Good luck for all your preparation, and I'll see you in the next video. Bye bye.